We're presenting data on the KarMMa trial, and we've done a subgroup analysis focusing on the high-risk patient population in this KarMMa trial, which was presented at ASCO. As you all remember, this was a total of 128 patients, and at least a third of these had high-risk features. And the way we defined high-risk was high-risk by cytogenetics, high-risk by tumor burden, high-risk by R-ISS staging, and also included extramedullary disease. And nearly half these patients had one or all of these features. And we looked to see whether or not the responses in this patient population was any different. When we looked at this data in our subgroup analysis, what we found was the response rates was pretty comparable to the rest of the patients, so not a big difference in terms of response rates, except in the R-ISS group. Now, the R-ISS group includes patients with high-risk disease as well as high-risk cytogenetics. And outside of that, all of them had an overall response rate of more than 65%. And even those with the presence of extramedullary disease actually had an extremely high response rates. CR rates in the majority of patients was in excess of 20% in this patient population. Again, underscoring the fact that Idecabtagene Vicleucel is a treatment strategy which can absolutely be used and should in fact be specifically used in this very difficult to treat high-risk patient population. Now, based on the KarMMa trial, based on the fact that we'd really enriched for this high-risk patient population, we do have 2 ongoing trials looking at high-risk disease specifically. We have an ongoing trial called KarMMa 2. These are patients who are progressing either after a transplant or within 18 months of the induction treatment with evidence of high-risk cytogenetic features, and they're getting CAR T-cells early on as their second line of treatment in the context of myeloma. The other clinical trial which we're doing in the context of high-risk disease is upfront. So if you have cytogenetics which portend a high-risk feature such as the 414, 16 translocation or the p53 deletion or mutation at the time of diagnosis, you can actually get CAR T-cells instead of getting an autologous stem cell transplant. So these are ongoing trials and will validate what we've seen in the KarMMa subgroup analysis of efficacy and improvement in duration of response, as well as progression-free survival in patients with high-risk multiple myeloma.